Good afternoon, and thank you for tuning in today. On behalf of the University of California, San Francisco Alumni Association, the UCSF Department of Psychiatry, the Greater Good Science Center at UC Berkeley, John W. Brick Mental Health Foundation, and the Mindsight Institute, welcome to the 8th webcast of our series titled Emotional Well-Being During the COVID-19 Crisis for Healthcare Providers. This week's topic is Resilience to Traumatic Stress When the Body Keeps the Score. I will now turn it over to our host, Dr. Alyssa Epple.
Thank you, Mario and John. Welcome, everyone. So good to be together in our 8th week now. Today, before I introduce our special guest, Bessel van der Kolk, I have our surprise speaker, and I'm just so pleased to introduce to you Doug Ziedonis. Doug was the chair of the Department of Psychiatry at UMass for 10 years. He is a very distinguished physician researcher in mental health and addiction research. And now he is a cousin. He moved to UC San Diego, where he has been the one of the associate vice chancellors for their health sciences. He's also the director of the fabulous UCSD Center for Mindfulness. And he really is a big change maker. So he's been involved in these across UC 10 campus-wide health initiatives. How can we improve the mental and physical health of the UC system? And so I've had the pleasure of working with him recently on some of those initiatives. I had the pleasure of meeting him many years ago when I gave a talk at UMass in psychiatry, left with some great research ideas, but what really lasted was a CD of his. He is an incredible musician for world music. Welcome, Doug. I asked him if he's dropped all his music because, you know, during a pandemic, sometimes our favorite hobbies disappear. And in fact, his answer was he's been playing every day. So Doug, tell us how you've been as a human being and as a leader during this last couple months.
Well, thanks, Alyssa, for that really generous and kind introduction. And you've just been an amazing person. And because of your national, international abilities in this space, we were glad to have you come to a grand rounds. And now I'm happy to be part of the UC family again. You know, I think it depends on the time, the moment when you ask that question. If you had asked in mid-March, I might have a different answer. The stress level was particularly high, whether you're working from home or in the front lines and worrying about the tsunami that might be coming. What would we look like New York City? So I think public health has really worked together well with clinical to keep flatten the curve, and still a lot of stress going on, a lot of fear now moving more into financial, and I'm sure emotional will be the next wave. So I think it's really great what you're doing and putting on these events. And you know, we have a lot of programs for people at home and also on the front lines, and yes, the isolation, the loneliness, the stress, the fear, the guilt, the anger, we're seeing it all. And also being an addiction specialist, we're also seeing a lot of more alcohol use and tobacco use and other substance use, probably to cope with both loneliness and stress.
Oh, yes, thank you. This is such a complex landscape. And when you and I are done, Bessel is really going to dive into those things, the ways people cope, often with substances, and how we store stress in our body. So we have a real somatic focus today. And I just love getting at stress from all these different angles. We cannot know what each person is experiencing at the moment. We do know we were all filled with adrenaline. We went through that pre-surge stage, and that was intensely acute stress. And now we have this kind of long runway. Our aperture has to change so that we're prepared for sustaining ourselves and promoting resilience during this kind of long haul we're in. And then, of course, some people are under absolutely acute or traumatic stress. Our frontline workers in the difficult cities, We have people's personal situations at home. We cannot know what's happening at home. Relationships and financial stress, two of the biggest ways stress gets under the skin. So Doug, when you think about your institution and your role as a mental health leader, what do you think about what can we do to change and become more resilient in our structures, in our workplace, in our work relationships?
Yeah. Well, I think it starts with leadership, valuing clinicians, valuing the front line, making sure to communicate clearly with them. Because sometimes it's simple things like being valued and getting clear communication, transparency on what's going on that makes a difference. And then creating some space for people to make sure to take care of themselves and also inquire about whether they've been able to do that. Our group, we already had one of the evidence-based approaches of having wellness directors in our departments. And a lot of universities and health systems are creating chief wellness officers in that spirit. And Tate Schettenfeld and others have talked about and written about how that's an important mechanism. What we saw in the COVID time period was a surge by those folks and really taking on leadership and trying a variety of different things. For example, in our emergency room where people were still coming in, Karen, one of our leaders there, she decided that it would be good to have people trained as peer supporters, and we created a whole program around that. So they, almost like a cup of coffee where you might notice a behavior that shouldn't happen, the peer supporters are looking to notice when they see someone that might need someone, just need to be heard and talked to. And so that created a whole cadre of folks who are reaching out and with empathy and compassion, not trying to fix anything, but just being there and saying, hey, is there any way we can help? Any way the system could help? So that was an important thing, and people wanted to know what was going on with communication. We had another anesthesiology department, Byron, took a lead on a different idea. He said, you know, we're all running around, but let's make sure everybody feels touched this week. And so he had a team of 5 that would text literally everybody in the department. And it might be 2-3 hours later till they got a message back, but it he said, I couldn't believe just simple texts sometimes elicited paragraphs of comments back as another way to connect.
This is what you just described as something we've only thought, dreamed about implementing, is connecting us through a web of support, either in dyads or larger groups, and using texts, all these things that we need to move into the next stage for. So I'll consult you on what we're developing here in psychiatry. It's definitely the next frontier. We can't go on. Things are changing so quickly. We need to have communication. We keep having these town halls every week. I'm like, not another one, but it's so important. There's so many rules that are changing, and we need to hear it from, the leadership. So there's lots of, Zoom meetings with good communication. And then this next step of creating, we don't know how long we'll be distance. We might be distance on and off. So we need to be connecting to each other in meaningful ways. So Doug, you also got a chance to train your peer support team in mindfulness and compassion. And I would love you to, maybe take 5 minutes or less, sorry, and just tell us, like, what would you, if you just had a few minutes to gift us with an experience of bringing us into this moment with some kindness, would you mind leading us through that?
I'd be happy to do that. And I'm also going to put in the chat room 2 things. One, I just put in a link to our online free Zooms that we have each day, so people, if they like this, could do more. We also have pre-recorded sessions that would fit into anybody's schedule and other resources, and I know you're collecting resources. And a second item I just sent is this we give for clinicians. This is to practical things that they could do, a list of 14 things, and I'm going to just mention a few, and then we'll go into the guide.
And that document is also on our website under resources. And people have been asking, how do I find the recordings for these webinars? Because you might have been getting them from the Alumni Association. All of the recordings, as well as these resources, are on the Department of Psychiatry website under coronavirus. That's where it all lives now. Thank you.
But here would be an example, and I'm going to talk first, and then we'll do. But we all have to wash our hands a lot more, and it can be actually annoying to think of that. But to reframe it and take back washing our hands and thinking of it as a moment of self-compassion. My wife will rub her hands with cream, and say, "Oh, this is actually therapeutic for me," and it's gotten us to reframe hand washing as an opportunity to really connect to yourself in a touch way. And I'm sure Bessel will talk a lot more specifics about it. But I'd invite all of you, wherever you're sitting or standing or lying down, there's 937 of us sharing this moment together. I invite you just in a dignified position. Just notice the support of the chair, perhaps the floor if you're standing. Feeling your body. Be noticing some tingling in your feet. Air blowing against your body. Perhaps a little tension in your forehead you didn't notice before. Being curious. There may be some pain. Just taking a deep breath now, with an inhalation, an exhalation. Breathing in kindness, blowing out peace. I want you to close your eyes if you haven't already, or slightly open, looking downward. I invite you to notice your breath, perhaps in the abdomen and chest as it rises and falls. Perhaps noticing your thoughts and feelings. You might be having a busy mind day. Maybe calmer. Where's your mind now? If it wasn't on your breath, just bring it back. Now I invite you to imagine one of your good friends. You visualize that person. They're coming up to you telling you they're having a bad day. You just did something they feel bad about and wish they hadn't. Imagine yourself, how are you going to speak to that friend? What's the tone of voice? What are you saying? How's your body feeling? Just making notes of thoughts or feelings that might have arisen. Now I'd like to have you have a different image. Let's imagine you had a bad day. And there was something that you did you wish you hadn't done. Your mind's spinning. What are you going to say to yourself? What's the tone? How's your body feeling? Make note of that. Thoughts or feelings that have arisen. I invite you to do one of the compassion soothing techniques we try. Because you're in that moment of feeling that stress yourself. You're using a stop technique of recognizing that your mind's spinning. You're taking a deep breath. You're observing what's going on. You're saying a few kind things to yourself about you're human too, and it'll be okay. Now I invite you to, with your hand, touch your chest or your arm or your leg, any part that would feel comfortable for you. Just applying some soothing touch for yourself. In this COVID time period, there's a lot less touching going on. We have an opportunity to do some self-soothing. For some people, it might be that you hold your hands together. You're at a meeting or you're on a Zoom call and you're just having a small moment for yourself to be kind to yourself. So now I invite you to slowly open up your eyes and notice the room that you're in. As we're going to have a really terrific presentation today, and hopefully all of us will learn something for ourselves as well as others. And really we are in this shared humanity moment. I was on a Zoom call with John Kabat-Zinn and there were 22,000 people. And people from all over the world, Italy, and this was in the middle of the craziness of uncertainty. Not that we're out of that. But, hopefully some of this was helpful to many of you if you haven't already been doing this kind of practice. And there's lots of resources to learn. And if you're a physician, Headspace is for free now, and they'll give you, and if you're a student, it's $10 a year. So I'm sure Alyssa's done many other ways of getting that information out to you. But
no, that was so lovely. Thank you so much. And your point cannot be, overemphasized about the importance of touch and how we need to touch ourselves, and that is self-soothing. And I can't give you a hug, but I can give myself a hug and send you one symbolically. Thank you so much for joining us.
Yeah, well, thank you. I'm really looking forward to Bessel's presentation and the whole panel.
Wonderful. So now I would like to welcome our moderator today. And it has been a delight to meet David Bullard, who is one of our volunteer clinical faculty. He's been with us at UCSF since 1978, and he has led a clinical practice on including healing with people with experiencing past trauma for 40 years. And it has been so wonderful, David. Welcome to have your participation in our department coming together with COVID resources. You have been, a tremendous source of voice of reason, wisdom, calm. So it's been, and helping me plan this webinars, the whole series, not just this one. Thank you, David. And David, I will introduce his friend Bessel. Welcome, Bessel. We are so honored to have you. We are just so fortunate to hear you at this time. For those, I feel like you don't need an introduction. Bessel van der Kolk is a professor at UMass Medical School. He has been a very early pioneer in understanding neurobiology of trauma, some of those first studies scanning the brain with PTSD. and really moving toward what works. What works besides the technology that is already out there and well studied, such as some cognitive behavioral techniques. Bessel has understood that trauma is a whole body experience. He wrote a book in 2014 called The Body Keeps the Score, Brain, Mind, Body, and Healing of Trauma. It's like a meme. The body keeps the score. That was only since 2014. I mean, we say that and think that all the time. So thank you for bringing that phrase to us. There's so much wisdom in it. Bessel was one of the first to conduct trials on, I will say alternative, but they shouldn't be alternative, methods for healing stress, healing trauma, like yoga and EMDR. And I won't spend any more time because we want to hear from him. So I will disappear until the end. Thank you, Bessel and David.
Thank you.
Thank you, Bessel. Good to see you. Thank you, Alyssa, for a wonderful introduction in this whole series. And your group at the Department of Psychiatry has done a Manhattan project in getting resources together for healthcare providers and staff and first line people and everyone else who's helping everyone during this very difficult time. Because we're at UCSF, Bessel, I have to first acknowledge Marty Horowitz, who would have done this year the Wallerstein Lecture, which is the most prestigious lecture I believe we have here. And in 2016, Bessel himself gave this lecture. And Marty's work has been, he's about the only person I know who's been at UCSF longer than I. I got here in '74. And he's been here before then. He's written many, many books on stress and much research. And as well as being an emeritus professor and a distinguished professor of psychiatry, I just have to show this. He's also a Sumi artist. And this is a beautiful stork, Sumi-e, I believe it's called. Other people call it Sumi. That sounds too legal for me. Bessel, we're going to ask you to give us some context for our discussion. And we don't have a lot of time, but I think we can make some great points that will help the people who may want to understand stress differently than they had. So as I lead into that, we're talking about very difficult things. But I also think it's okay to have humor in the moment. And my favorite role model for that's the Dalai Lama. In 1984, he was interviewed by a woman journalist, and he was telling her about the terrible things that had happened to his people and his country, all kinds of things. And he had such depth of grief in his eyes and tears. And he looked out the window at a tree, and when he looked back at her, he was full of a kind of bliss and said, "Life is so very colorful, isn't it?" And so we're going to be touching on very painful things, and all of you will be touched because of your own personal experience with stress and trauma in your medical and other helping professions. But it's okay for us to laugh, and maybe humor as a body response will be something that Bessel can tell us about. So Bessel, your background, University of Chicago,
Yep.
Medical.
So the first thing I want to say is that as a medical person, you're trained for this stuff. And in fact, some of your finest moments as a medical person are in the intensive care unit, in the emergency room, where you can use all of your senses, all of your capacities to do what are oftentimes amazing things. And that's really what we are trained at. And we all get trained to face death and to see horrendous stuff. And that's part of being a doctor. That's something that people who are not trained in medicine oftentimes don't understand. This is, in some ways, our bread and butter. In following people who are exposed to the current crisis, there's two things that are the hardest for them. One is the issue of loyalty that Doug really was beginning to talk about. As long as you get all the support you need, you get the leadership who is totally on your side, who sees what you're doing and says, "Wow, thank you, you're doing all you can, we're giving you all you can. As long as the institution is there for you, you will work. We are trained to work and to take part in our work. So give it every opportunity and support to do the best work you can, including all the coverage, et cetera, is part of what it's like to be a doctor, a nurse, a healthcare provider. But you need to be given a chance. So when you feel an internal sense of obstruction, of self-humiliation, not getting what you need, that is what makes it hard. The second thing is you need to go home and relax. And that is always a difficult thing because your whole body is set for very high arousal. You don't sleep, you get trained not to sleep, you're up all the time, your neurohormones are way up, and now you need to go home and relax. What do people usually do? They go and lie in the arms of the people they care for. And that is how we calm our bodies down. And the issue of touch was talked about before, but the issue of not being able to go home to the people you love is extraordinarily difficult. And I think that's our defense. As we come home and hopefully we play with our loved ones, with our boyfriend, girlfriend, wife, husband, and our kids. And many people are deprived of that. And the big question is, how do you stay in touch and in deep contact with people you love? And how do you get a deep sense of safety and relaxation that you get from lying in the arms of your loved ones? And so it's not surprising that if you're in a state of high arousal and you cannot calm your brain down, that you grab for the bottle, you grab for dope, and that is not crazy. That's what people do. People use substances in order to change their frame and change their being trapped in a particular state. And I'm not completely condemning of that. I think that may be sometimes helpful. You need to know that, of course, you know that already. If you do that, you're also at this point at a high risk that this becomes a habitual way of dealing with things, and at the long term, that may cause trouble for you. And so you need to find alternative ways of calming yourself down. And that is really where the challenge is, because this is a bodily issue. As far as I know, and I may be wrong about it because you guys are the front lines right now, I'm not, is you don't really want to talk about how you feel. And you don't really want to talk about what you have seen, because when you start talking about what you've seen, all that stuff starts coming back, and it may just rile you up further. If you find comfort in telling people about it, great for you. But on the help-giving part, we should not expect that people feel better by talking about it. It's really something you need to check out first. What's important is to calm your body down. After 9/11, we did research to see what was the most useful intervention that people could get after exposure to trauma. And people said, massages. So how do you help that body to get its natural self coming, to get that body to feel itself, calm itself down? I was delighted with Doug's demonstration for us. It's very much what I think is very helpful for people, and we should do it. On our website, the Trauma Research Foundation, we now have 8 sessions with my partner, Lisha Sky, who is a body worker, who has 8, 10, 20-minute sessions of how to calm yourself down, almost as good as what Doug did with us. And we now also have 8 sessions from a Swedish yoga teacher who treats very complicated people, who does wonderful yoga sessions with people, also to calm yourself down. And so the question, how do you calm yourself down? Our culture, our Western culture, is not very good at it because we're very yakking and drug-oriented, but things like Qigong is helpful, Tai Chi is helpful, yoga is helpful, and I hope that many of you have a background in having done yoga and Tai Chi before, so that when you go on a website where you can do yoga and Tai Chi with other people, your body feels calmer and you feel connected. So one of the things you might think about is at your institution to have a yoga class for all of you together, because the issue of belonging together, feeling part of a team, being seen, being known, being looked at, being able to have a voice is critical at this point. But all of us who have done this work know that we get our comfort from working in a team. And that's, the US military knows that. First thing you do in basic training is you create a team. And teams go through extreme hardship, but people also feel very close to each other when they go through this hardship. So do something to help that team to come together and to support each other. And you're not going to support each other probably by talking about the horrors that you've seen, but you may support each other by making completely politically incorrect jokes to each other. And that's what medical students and what doctors do, is they do things and they just let it out. It's great that David says sense of humor is great, but how do we give people a sense of humor? I don't know how to give it to people who have a sense of humor do much better. And to see the absurdity of the situation. And part of how doctors traditionally have dealt with this stuff is to become outrageous. And there should be a room for you to be outrageous, where nobody condemns you for whatever you're saying or doing, etc., etc. So you can just let it out.
Just to validate, not that you need validation, you've taught so many people. I think at one point they estimated you were speaking in front of 15,000 people a year, but that was live.
But
that was live, and now you're reaching many more. A point about talking. I think we use talking as a way to connect, and you're a big proponent of the importance of connecting with people, as you were just saying. I wanted to acknowledge and thank you for years ago when you mentioned how important yoga was. I started yoga at the ripe age of about 69 or 70, and I'm 74 now.
Old white guy doing yoga for the first time, like, wow.
and you can do it without being hurt if you're with the right teacher, like I've been. Just to throw out something else in a body sense, that if people are interested, if they go to gagapeople.com, G-A-G-A people.com. The reason I have no financial interest in any of this, but it's some people in Israel and New York City, and they're doing these live classes that are free with a kind of expressive dancing where they somehow teach you not to repeat a pattern. A dear friend of mine who's been teaching dance therapy for trauma in Turkey and China and Israel and Jordan found it extremely helpful to do this particular dance style in a group, so you have a sense of many people with you, hundreds at a time. So that's one resource to look at. I wanted to mention.
What's important here is the feeling of a group. I think very few people would get comfort out of doing it by themselves, but seeing other people be silly and making eye contact with people and go like, boy, you look even crazier than I do, is really helpful. And to just really, but that contact is terribly important as a part of the whole thing. But
Elissa had also mentioned, besides the issue of stress that you described well, of what people are going through now, there's also the stress from what goes on in their worries about the future. And my brief story about that, a dear friend who's been involved in Zen for 50 years, a woman, we had her speak at a high-tech company monthly Buddhist group. And she spoke about her involvement with Zen because she was a student with Steve Jobs. And then she did a brief meditation, a Zen meditation. Then it was question and answer. And one young woman raised her hand and said, "What's the meaning of life? There are all these terrible things that have happened. People are terrible to each other. There's murdering and terrorism and greed and terrible things that people do. What's it all about?" And she very kindly, because she's a very small person, but a lovely person, she said, "It's true that throughout human history, terrible things have happened, and humans have that side of themselves. And it's true, things terrible are happening all over. But I hope you realize that was a story in your head. And if you look about you right here in this beautiful auditorium with 150 other wonderful people, I think you have a different reality. And that's another way to bring yourself back from catching the story in your head about what's going to happen. What's going to happen then? What's going to happen financially? What's going to happen? Try to bring yourself back to the present moment, which is why it was wonderful to start with Doug.
That's a very important thing about what's going to happen. Because when you get traumatized, the script gets stuck in your brain, and that's all there is. I think part of dealing with very challenging situations is that you know this will come to an end. So one of the great issues right now with the COVID is we have no idea when this will come to an end. So it's not like, oh, a month from now we'll see each other, we'll hug and go dancing and have a good time together, because there's no end. And that's how you survive your hard times in the ICU, your hard time in the emergency room. It will come to an end, and at the end I go surfing, or I go to Mexico, or I do something to make it come to an end. The issue of having something to look forward to that will make a difference is terribly important. It's very important for people to very carefully plan for particularly pleasurable activities that they can say, right now it sucks, and God, I can't stand it anymore, but next Wednesday I'm going to take an electric bike and go up Mount Tamalpais and look down on the bay, and I'll feel great. So it's essential that we have things to look forward to that will be different from where we're stuck at. So it's very important to activate our imagination of how things can be different, and to specifically plan for situations, activities, contexts that are different from what we live in. And we need to activate
that helps you.
And we need to activate our dorsolateral prefrontal cortex that allows us to see ourselves over time. And so one of the most damaging things right now is that what will our future looks like? So we need to create things for ourselves that at least I have that to look forward to, and that to look forward to.
And that's regardless of whether you actually make that bike ride trip. It's in the moment that you're filling your mind with the planful, positive something that you're. Then it's good to do it.
So when I talk about going up Mount Tamalpais, I have no idea when I'll go up, but I can already beginning to imagine the pleasure of doing that. And so you need to, your imagination of alternative realities is terribly important.
How have you personally, you're one of the world's leading, maybe the world's leading, absolute leading expert in trauma and PTSD. It's been your hope for so long. You've been studying it. You know everyone in the field. How have you personally been dealing with these times?
I do the things that I preach. I'm looking forward to this coming to an end, because I am going to take my electrical bike and go up the mountains of the Berkshires where I am right now. And boy, everything will be minor in comparison. I'm doing my garden. I do my yoga. I'm in regular contact with people all the time. I read stories to my grandchildren. So I very much practice what I preach. I have gone through every single treatment that, maybe because I needed it, that I describe in my book, and I know what works. And I know that neurofeedback works, and I do the research in it. And so these things are not just coming out of my imagination. We do it, and it doesn't only come out of the lab, we actually experience it. And so interestingly, right now, our research is with NAPS on use of psychedelic substances. And so helping people to actually live in a reality that's really different than the reality they're trapped in can give them a sense of self-compassion and go like, okay, I got trapped in a small part of reality, but the real reality is much bigger than what I am. And when you get traumatized, and I'm sure right now people who are seeing death and people on respirators over and over again get very trapped in it. And it's very important for them to have an experience that goes there. But the world is so much larger. And that's what the Dalai Lama did when he looked outside. The world is larger than the horror that I've seen.
And last year, I had the pleasure of being at your 30th annual International Trauma Conference in Boston in July. And Bill Richards was one of your speakers, and he's a dear old friend who's written a great book called Sacred Knowledge. And he's been involved with the Johns Hopkins psilocybin project, giving it to people with cancer who had death, what they called existential anxiety, and had tremendously positive results from doing just that.
Was a close friend of mine, who quite a famous person in the trauma field, actually. And I think my friend has lived much longer than we expected him to live, in part because he went through that experience at Hopkins and got to see himself in a very different perspective. It didn't take his cancer away, but it completely changed his perspective on what he was going through.
And there are
perspective, you know?
Yeah, absolutely. And I am part of a group that is training people, the California Institute for Integral Studies, in, when it's legal, training therapists to be able to administer and be with people during psilocybin and MDMA trips. I want to just get back to something that may make a point, which is I met you, or I heard you first in the late 90s, or I'd done EMDR training and all of that, but your presentation was really a breath of fresh air by your talking about the impact on the body. And then I met you at Esalen in 2003 with Peter Levine. You were doing a workshop together. And when I drove home from that workshop, I had the thought, this was the nicest day for my body that I've ever had. And what I mean by that is just by being embodied for a weekend. The whole training was about that. A way, though, I thought not many people have had the opportunity to do that, but let me bring this home to some of you who either are parents or perhaps have pets. And my daughter's 38. I still have a sense of the imprint of her head. I'm in a rocking chair and her head is here and she's sleeping. And there's this wonderful feeling of trust. I feel like I'm being trusted by this infant who allows herself to go to sleep. I feel that on my left upper part of my chest. And there are things like that that we carry with us that are on the negative side, but there are ones that are on the positive side too. And anything you want to add about your own sense of the role of the body?
Well, I think you're absolutely right. And I'm thinking about Doug's exercise with us a little while ago. You know, it went fairly fast, but I imagine that for a lot of us, things came up and we had experiences that brought back memories and brought up memories and brought up sensations. Sometimes, and we have to be careful with that, when you do these mindful exercises, people get triggered because the traumatic imprints are like the imprints of your daughter against your chest. They're very somatic. And sometimes when you go into your body, a feeling of terror may come also, which is also quite possible. And then that's why it's so important to do these things with somebody who has a kind face and a trusting voice. John Kabat-Zinn was mentioned earlier. John is such a person, for example. And when you meditate with John, you feel calm inside because his voice holds you. So we hold each other with our voices and with our faces. And so it's very important for us to activate these memories, but in each other's presence. And so I'm very much looking at you right now. I don't know if the camera sees that, because I'm really living off your interested and kind face in helping me to talk what I'm talking about. And so we need that for each other. And we need it from our head nurses. We need that from our chief surgeons. We need it from our pulmonologists, of people who, that we look at each other and say, how are you doing today? And if you need to cry at that particular point, you just cry. And nobody needs to fix anything, because to just be there as part of our humanity, of people who value us and trust us, is really critical right now.
I'm glad you added the voice. Have you heard of aphantasia? A-P-H-A-T-A-S-I-A?
We know about voices. Like, yeah. It's interesting hearing that Douglas is a musician. We do a lot of music with people also, and voicing and singing is a very important part of the whole thing. Those Italians got it right when they started to sing when they were locked up there in Naples and Milano, you know. Like, yeah.
But in terms of receiving a soft, caring voice, I'm not very visual. My imagination, my ability to picture even my daughter and son, that's a difficult thing. And though in one of the somatic experiencing trainings that we finished in Brazil, at the very end of a 2-week session with Peter Levine's group, in which we did this stuff every day, I was lying on my back, and the woman facilitator was just whispering in my ear. I would tell her what my body was experiencing, and she would say, "That's good," and "What's more?" It was a very soft, calming thing. At the end of that, I believe I yawned about 40 times. And that's a parasympathetic response, and it felt really wonderful and relaxed. So anything you can do to deeply relax. I want to shift, we only have a couple more minutes. The current trauma treatments that are mostly used in VA medical centers and in other institutions are exposure-based, which means if you have a past trauma, you have to bring it to mind and work through it in a very over and over and over and over again. And I know, I agree with you, but I know that your response to that is not the way to treat trauma. So I thought it'd be useful for you to say something about that for people. There are people who will not go to get help with a traumatic memory because they don't want to, it's too overwhelming. They don't want to bring it up. There are ways to deal with it without having to be overwhelmed.
Well, you should never do trauma treatment where people get overwhelmed. The whole issue is it becomes safe to remember. That is really what this whole therapy is about. You calm people's physiology down so you make it safe for them to know what they know and to feel what they feel. And that's our job as therapists, is to make people safe to be who they are. And there's not to blast people with things that scare the hell out of them, because then they just desensitize you. You don't want a less sensitive person. You want to be with somebody who says, yeah, I was molested as a child. It was awful. And I'm so grateful that it's over and that I won't be triggered when I have my own kids, because I know now what it feels to be loved. And to not blast people with things. I was very much also reminded by something that Douglas did, and you said, and that is that when we are hurt and upset, we forget how much power we have with other people. And for us to know that if you look kindly at me or I look kindly at you and affirm what you're saying, you feel calmer, you feel safer. And you get back in touch with the power that we have to make each other feel safer. And I was very impressed with Douglas, who's clearly doesn't spend his life on ashrams, leading us through a mindfulness meditation session, knowing that if he does that with people, that people feel calmer and people feel safer. And that's the power we all have, that we have enormous power for good, not only for ourselves, but for each other. And this is a time not to forget how we can make the world a better place by affirming each other, listening to each other, and being a presence for each other. Not only you for me, but I for you. And this is reciprocal.
Thank you for that expression of hope, because hope is another important ingredient in our getting through these times. Another more of a cognitive thing is the don't know mind of Korean Zen, which is when you catch yourself going too far in the future about negative things, bring yourself back to the understanding that this is now. I have no way of knowing exactly what's going to happen. And they say when you accept that, when you don't trip out too much on the future, you're actually enlightened because you're just in the present moment. I have colleagues who, yeah.
But what you were saying and other people were saying is to really feel the pleasure of your rhythms, feel the pleasure of your voice landing on my ears, the fact that I'm saying something and you nod in response, and that there's something happens between us, even though terrible things may be happening around us, the sense that we can mean something to each other at this time. You know, I belong to some of the COVID social media group, and there's an enormous amount of support that people have for each other, and we can be really very present for each other because you know what your fellow people are going through. And so even though you feel terrible yourself, you may just try to make a connection and say, boy, doesn't this suck? Yes, it really sucks. And just to be able to say that is useful.
Thank you, Bessel. We're going to turn this back to Alyssa in just a moment, but I thought you and I and Doug and Alyssa can take just one moment to look out at the audience, many of whom are dealing with things that we don't have to at this point. And I never have in terms of the life and death situations that you articulated in the beginning, but how much we appreciate what you're contributing to so many lives. And I encourage you, each of you who's listening right now, to imagine and remember and think about all the lives that you've touched. And you can't save everyone, but you have impacted everyone. Thank you, Bessel, for
Welcome.
wonderful honor for me to be able to talk with you. We were going to have dinner together, and we made it to the same restaurant, but we messed up and we were there on different weeks. But this was almost as good as that dinner conversation we didn't have.
I had a great dinner by myself. I was surprised how much I enjoyed my own company that night.
Thank you so much for, such important, I don't want to say simple, but the essentials in this conversation emerged so clearly. It would be so nice to end with a moment again together of feeling that safety, collective humanity and safety in our body. And Bessel, I know that, we've talked about the tapping as being something that we don't have the clinical trials on yet, but it's really being used in the field. And it's one thing that I think a lot of us are unfamiliar with still, who are not disaster mental health clinicians. And I'm just wondering, is that something you could just maybe tell us a few sentences about why this is helpful, why this appears helpful to clinicians so far? I know that
I don't have tapping right now, but I promise you I'll do tapping sequence on our website and post it.
Okay.
That people can follow that. There is some evidence for it. It's very important that the only thing that gets funded for research is stuff that fits within the paradigm. I had a hell of a time getting funded for my yoga research because it's weird putting your ass in the air to get better. And so it took about 6 NIH applications before we finally got it. Neurofeedback, spectacularly effective. I've had 6 NIH grants and I still haven't been funded. And so what gets funded is what works, what's known already, but what isn't known yet doesn't get funded. Back to Doug.
Well, this was a terrific presentation and day, and Alyssa, you get a lot of credit for that. And David, thanks for your great questions that got Bessel to talk about it. I do think it's important that people reach out to one another and support each other in this time, and even simple things that we talked about today and that you have resources for can make a difference. And we're going to learn a lot from this pandemic, and the world won't be the same. Telemental health is already way different than it ever was. So thanks again.
So thank you, Doug. Again, reminding ourselves of what's most important. I'm going to end with a few announcements, but before I do that, I'm going to ask us to do something that's uncomfortable for us because we're, heady clinicians and we think it's all in the head. And that is to do that self-comforting touch. I'm going to do a hug and I'm going to send it to all of you. And all of you out there, I hope that you can hug yourself and let yourself feel that kindness that Doug described that you give to others toward yourself.
And if you feel like crying right now, that's okay too.
Yeah.
Because we oftentimes get very triggered when we finally let go. And it may look really bad. People may start sobbing when they start touching. And that's okay too.
So tomorrow, if you feel like you can look at a screen, starting tomorrow is a beautiful conference, a one-time thing called Never Alone Summit. It's free, it's global. You'll be watching with probably 20,000 people. If you just type in Never Alone Summit, you will find it. There are roughly 10-minute talks by hundreds of experts in mental health. I'll be on early in the morning introducing the BRICS, the sponsors, and Deepak Chopra is another sponsor of it. I wanted to mention the 31st Annual International Trauma Conference looks amazing. It integrates neuroscience. This is Bessel's child that he's been fostering the field. This annual conference, I've heard amazing things about it, including from David. The speakers look fantastic. A whole education for any mental health professional or others interested.
And I just 1 second on that. Last year, one of the most powerful plenary sessions was a discussion between Tarana Burke, who was the real founder of the Me Too movement, previous to all of the stuff from Hollywood. And she was in conversation, and it was, it may be available on video. It was wonderful. And lastly, I wanted to just say, besides, there's hope out there for those of you who may have had a very difficult experience in your life, whether it was childhood or during this time. There now is something I'd encourage you to look into called the FlashTechnique.com. I have no financial interest in it, but they've discovered a way to work with some traumatic or disturbing memories without exposing yourself explicitly to the memory, and you don't even have to talk about it to the therapist, but you'll see information there.
Thank you, David. And on our psychiatry website, we now have a library of over 20 short videos of techniques for acute psychological care. And a beautiful short meditation by David is there for your experience. It's a positive memory conditioning in your body. It's very lovely. Next Thursday, I look forward to seeing you all again. Please come back. We get to speak with Esther Perel for an hour. She is a phenomenally brilliant family therapist. What I have seen in my getting to know her and being with her is that she wants live questions. We can't give her live questions. You give her a family scenario and she will talk to you about very insightful, deep dynamics that are helpful within minutes. I mean, I've never seen anything like that. She's not gonna be able to do that live. She's an artist, she's a performance artist, and we can't, because of Zoom bombing, we can't hear from you live. Send us your questions. When you get the email from John McCoy, type in your scenario. You don't need to tell us names. Just give her a paragraph. Give her a sense of what you're struggling with. There are, I promise you, there are common patterns in all of our own relationship dynamics that she will pull out and be helpful. And no names, don't worry. So send us what you're struggling with and you'll hear from Esther Perel. Look forward to seeing you all next week. Have a wonderful week. Thank you, everyone. Thank you, Bessel, Doug, and David.
Pleasure.
Thank you.
Bye-bye.